The biggest challenge with doing research is time. So as nurses working in the clinical environment, you don't have a lot of time. You're really busy with your clinical duties. So finding that time to actually do the research that you want to be doing is quite difficult.
How to write in the appropriate way to be successful in grant writing and applications for research funding. Knowing how to negotiate time to then incorporate project and research work into your working week. So being able to negotiate protected time for nurses is a bit of a new concept, which I'm a real advocate for, and I do spend some time talking to the nurses that I mentor about how to build project and research time into their work week.
I think the main challenge with doing research is definitely money, resources, support. I think firstly it's having support from the organisation and from your direct manager, because you need time and resources. So that's probably been the biggest challenge.
Anyone who does research will say one of the biggest challenges is ethics, and I learnt that as well. I think that's someone going into research needs to appreciate how important it is. I was doing multi-site applications and it took a lot of time. I think one of the other things when you're new to research is wanting to solve all the problems at once and wanting to actually have a large scope of what you want to look at and how you're going to solve it, and finding it can be very hard, and that sometimes you need to be very smart in your research questions and how you design that, very specific, measurable, achievable, realistic and timely.
The way I have managed some of the challenges that are relevant to nursing research is always try to endeavour or strive to continue to develop relationships, professional relationships with colleagues, and particularly across multi-site. So not being in silo and doing work as an individual, but being collaborative, talking to other people about what they're doing, sharing in their work.
My passion to do research means that I do work outside of hours, or if I'm quiet at work, I will spend the time working on projects. But having the support from my manager means that when there's an opportunity available, she will provide me the time and the resources and the support to be able to allow me to work on my projects, which is fabulous.
How do I balance clinical work and research? Well, if you find the right answer for that, can you let me know? It's always a challenge, but I guess it is one of those things that I find that is really important. I think that historically it's been clinical work or research, which for me, I think that the beauty of it is actually having clinical work and research. So that way the research that you're doing is relevant to the clinical area. So the clinical area is informing the research and the research informing the clinical area. So personally, I hope that things will change more so that nurses that are interested in research don't have to choose research or clinical work. So they actually can do both because they go so well together.